Hello everyone, welcome to my channel. My name is Dr. Kirsty Griffiths and I'm a chiropractor and a yoga instructor. Today I'm going to be talking to you about my 5 tips for managing health in body and mind during this pandemic. So starting with number 5, we're going to be talking about exercise. The good news is that there are a ton of free resources that are available right now. So some of those include YouTube videos. One of my favorites is Yoga with Adriene. She has a really large following, but she puts out a ton of free content, so that's an option. And then scaling it down to a smaller level, one of the practices that I've been following along with is Yoga Nomads. So you can check them out on Instagram. There are a couple of ladies from Guelph who are offering free yoga classes, live streaming a couple times a week, and there's a handful of other places doing the same thing. So a couple of the organizations that I work for, Movati Athletic is one, the University of Guelph is another, are offering similar services where they're live streaming yoga classes and other types of fitness classes throughout the week as well. So one of the other things that I want to talk about is accessing some of the paid resources that are available to you. This is really important to continue to keep supporting our local businesses. So even if you are accessing some of those free resources, it's nice to also access some of the resources that are available to you through a membership or a subscription service. So one of the companies that I have partnered with is Loyobo Fit. It's a small business based out of Guelph. And the benefit to this is that you get a lot of added value on top of just getting an exercise class. You're also getting a sense of community. These classes are being streamed and you can actually see some of the other participants. There's reward systems that are in place for attending classes. So you're really getting a lot out of it, similarly to what you would be getting if you were attending those classes in person, and we're just shifting to a virtual mode. I'm also going to be including for you in coming days a video on how to set up a practice or a movement space in your house, so designating a specific area, and I'm going to talk to you about some of the household items that you may have that can be used in place of traditional gym equipment that you might not have access to, so keep your eyes open for that. Okay, number 4, we're going to be talking about nutrition. So maintaining some sort of consistency and some kind of schedule can be helpful, especially when there are a lot of things that are unscheduled right now or lots of changes to our routine. So continuing to have breakfast, lunch, and dinner, trying not to be eating too late at night can be helpful as well, and then being aware of your patterns with snacking throughout the day. One thing I will say about this is that the body is under extra stress right now, and so you're going to find that your cravings are a little bit different and the energy that your brain needs is higher than it normally would be. So notice if you're finding that you're craving different types of foods, or you might be finding that you feel the need to eat more than you normally would. It's okay to honor some of those signals, but also recognizing when are those things unhealthy patterns. So are we eating because we're hungry, or are we eating out of a distraction mechanism and it's just something that we're able to do to go to the cupboard and eat something instead of managing some of the other things that are actually coming up for us. So sometimes just starting to pay attention to those patterns is a way for us to start to change them and to manage them. So one of the other things that you can be doing right now is meal planning, and this is something that you may not have had time for in the past, but you might find that your schedule allows for this now. So pulling out some of your favorite cookbooks, a couple of mine are Yum and Yummer and the Looney Spoon series, mapping out some of the meals you want to make for the week. There are a lot of grocery stores right now that are offering either pickup or delivery service, but they are often delayed by a few days. So one of the ways to manage this is to actually plan out some of those meals in advance. You will get your delivery within the week usually, and then you'll know exactly what those ingredients are being used for and which days you're going to be using them on. I'm going to be posting some of these recipes that I'm making on my Instagram account, so feel free to check that out, The Chiropractic Yogi, for some food inspiration if you are bored with your normal routine. Number 3, we're going to talk about healthy sleep. So having a consistent bedtime can be something that's helpful, but maybe something that is difficult right now. If you're like me, you might be finding that because you're not setting an alarm in the morning anymore, the tendency is to stay up a little bit later at night. This is not too much of an issue. We want to be aware of this because when you do transition back into your work routine, we don't want to make it too difficult to get back to getting into a schedule with going to bed earlier. However, if you are finding you're staying up later, making sure that you are getting the required number of hours of sleep. So still aiming for that 8 hours, and that might mean that you're sleeping in a little bit later in the morning. If that is an option that's afforded to you, then that's great, but just be aware of how many hours of sleep you're getting. If you're looking for some more resources on actually setting up your sleep space to have a better quality of sleep, check out the video that I posted last week on my Instagram TV. It's about a 10-minute long video. I walk you through my sleep space and talk to you about some strategies on how to set that up for a better quality of sleep. The other thing to be aware of is your caffeine intake. So if you are drinking tea and coffee in the afternoon and you're noticing that at night you're laying in bed awake, having a hard time falling asleep, or that your anxiety feels like it's heightened at night, sometimes that can be related to and enhanced by caffeine. So if you're noticing that that's a pattern for you, that you're having a hard time falling asleep at night, try reducing your caffeine intake to 1 to 2 cups a day and making sure that you're consuming those in the morning. Number 2 is stress reduction. So the first strategy I have for you is limiting your exposure to media. If you're like me, some of us are very sensitive to negative media, and when you're constantly being bombarded with catastrophic information, it can really start to affect our mental health. So setting boundaries on what that looks like, that might mean that you are limiting the amount of screen time that you have, where you're actually looking at those news stories or updates on what's happening with the pandemic, or it might mean limiting the sources that you're looking at that from. So going to trusted sources, some of the government sites instead of the news channels, which can give us different information and sort of from a biased perspective. So just being aware of how that content is affecting you and starting to set some boundaries with that can help to maintain some mental health while we're working our way through this. The other thing is to engage in feel-good activities. This is going to be different for every person, so this might be exercise. That's one of the things we've already talked about, but for many people, engaging in exercise is a feel-good activity. It releases chemicals in our brain that do make us feel good. Some other things are things you might normally not have as much time for. So for me, setting up a home spa, doing face masks, or having a foot bath, these are things that you can build into your daily routine that generally make us feel good, and they should be practiced on a consistent basis. Other ideas are mind-body practices that help to shift the nervous system out of a state of stress and bring it back to a place of rest. So breathing exercises can do this, guided breath work, as well as meditation practices. Again, I'm going to be releasing resources related to both of those on my Instagram account. There is already one video, which is a guided meditation on my Instagram TV, but there's lots of other options for you for using those resources in terms of mindfulness practices, meditation, and breath work. And then my number 1 tip for managing your health right now while we're dealing with this added stress is to find purpose. So what is your reason for waking up every day? Most of the time, our idea of purpose is a very large scale concept. So we tend to have a sense of what's happening in the future, what types of goals we're working toward. And right now, a lot of those things might be unanswered questions, and you might have lost sight of what that looks like because we're not really sure what's going to happen in coming weeks and coming months. But now is an amazing opportunity to dial that in a little bit and actually find purpose in this moment right here, in this day, in the time that you can see a foreseeable future. So one thing that's helped me to manage this is setting a schedule for my day. Even if that means that I'm including some of those mundane tasks that I normally wouldn't write down, but that can be household chores or an exercise class that I'm doing that day or a task that I have set aside for my business. But actually mapping that out gives me a sense of purpose. I know what I'm working toward. And if for you, you're a little bit unclear on what some of those things are right now, my suggestion is to start with things that are going to better you and then add things that are going to better the community around you. It's a good starting place for figuring out what you can be doing with your time right now. So I hope that has been helpful for you. For those of you who are my patients, I am launching a patient program that's going to be coping with COVID in body and mind. So it's basically an opportunity for us to go over some strategies in more detail. It's going to involve a 15-minute consultation so that I can understand what are some of the things that you're struggling with the most right now, followed by a 45-minute follow-up where I'm going to put a report together with a handful of resources to help you set up a plan for the next few weeks so that you can continue to improve your health during this time. Currently, that's only an option that's available for existing patients, but we are hoping that some of the rules will be extended so that we can offer that to new patients as well. If you are not currently a patient of mine though, I will continue to post free resources on my social media channels, so check me out on Instagram at The Chiropractic Yogi or on Facebook, Dr. Kirsty Griffiths, Chiropractic and Yoga, and I look forward to seeing you there.